Good afternoon, folks. This is Melissa, and I'm just checking in. We're getting ready to start the meeting here in a few minutes. I know Paula is remotely on with us right now, and I just wanted to double check. Paula, Kathy is here and she's ready to facilitate the meeting. So if you are okay with that, we'll go ahead and start with our Vice Chair, Kathy, running the meeting. Or if you are wanting to facilitate from afar, I'm going to give a pause here to see if you want to facilitate or if you're okay with Kathy. Okay, Paula, we're going to go ahead and have you just be in listen mode, and that'll be fine. Okay. Will you text her back that I will help her here in a few minutes, but we'll get the meeting rolling? Okay. We do. We definitely have a quorum.
Yeah.
Yeah.
Okay, let's call the order. Oh, sorry. Let's call the order at 3:04. And the first item is agenda approval. Do I have any motions to approve? Thank you. And any seconds? Thank you.
And please remember to turn your microphones on, guys. Thank you.
Okay. So then we move on to the approval of minutes from last meeting. Do I have a motion to approve that? Thank you. In the second?
Dean Romero, second.
Thank you.
And Kathy, I'm going to do a pause for a second. I'm going to do kind of some quick introductions, if that's okay, because we do have kind of an interesting, in some ways, our first real official kind of bringing in some age-friendly folks along with the Commission on Aging people today. So I'm going to take a few minutes and do some introductions with people. And so I'm going to start with myself. I'm Melissa. I'm with the Pikes Peak Area Agency on Aging. And as we go around the room, if you can just share that you're a commissioner from the Pikes Peak Commission on Aging, or if you're more aligned with age-friendly or with our staff, that would be super. So I'm going to turn it over to Kathy next.
Hi, I'm Kathy, and I'm a commissioner on the Pikes Peak Commission.
Wanda Wood, appointee El Paso County.
Carolyn Castan, Commissioner, Pikes Peak Commission on Aging. I'm also board certified as an age-friendly health professional and a new member of the age-friendly work group.
Penny Whitney, Pikes Peak Commission on Aging Commissioner, and with Age Friendly Pikes Peak.
Bob Foster, Commissioner from Teller County.
Dean Romero, Commissioner with the Pikes Peak Commission on Aging.
Dave Lord, and I'm with Pikes Peak Age Friendly and chair of the Housing Transportation Subcommittee and work with Penny on sort of coordinate age friendly. Happy to be here and again working with the commission.
Phil Stafford, Commissioner with Pikes Peak Commission on Aging and a member of the Age Friendly Committee.
Erin Elu, I'm Commissioner for Town Monument and Age Friendly Social Connections Chair.
Good afternoon, Mariah Cabrera, Contract Administrator for Pikes Peak Area Agency on Aging.
Joe Urban, I'm the Interim Director for the Area Agency on Aging, temporary interim director for the Area Agency. Thanks.
And we do have a guest in the room from Silver Key. I'm going to have her introduce herself.
Hi, everyone. I'm Becca Sickbird. I'm the newly minted Vice President of Grants Compliance and Strategic Communications at Silver Key. So I'm delighted to be here learning about the work of the Commission.
And then online, I'm going to call out Marilyn, if you want to introduce yourself.
Hello, I'm Marilyn Dawson, and I'm part of the Pikes Peak Agency on Aging Social Connections, as well as Age-Friendly Social Connections Group.
Thanks, Marilyn. And Steve?
Good afternoon, everybody. Steve Schleicher. I am a commissioner with Pikes Peak Commission on Aging, representing El Paso County.
Thank you. We have Tom helping run all of our tech. Thank you, Tom. And then in listen only mode, again, we have our chair, Paula Levy. She is actually helping to take care of an emergency situation in the ER. So that's where Paula is. So we won't expect much interaction from her, but she's listening. And then we have Sherry with the Pikes Peak Area Agency on Aging listening in as well. And thank you, Vice Chair Kathy, for letting me do the introductions. And I will turn it back over to you now to pick up with our public comment and presentation part.
So. I don't think we do, yeah. Okay, and presentations. None. So information items, membership committee.
So I don't know, some of these might be a lot of me making some comments here. I think that with membership right now, one of the biggest pieces we're looking at is bringing in any of the age-friendly folks if they want to be official members with the Commission on Aging, or if they want to continue to just act in an age-friendly capacity. We do have Becca here today from Silver Key who is interested in membership. So I'll be following up with Steve about that. And I think that's all I have for a membership update, unless other people have thoughts or input about membership. I see Penny.
Thanks, Melissa. Penny Whitney, I just wanted to identify that I had a rather lengthy conversation with Jamie, the incoming chair at the SRC, Senior Resource Council. And I have to admit, I've lived in this community my whole life, and I never really understood what the Senior Resource Council did. I think the scope of projects and programs that they offer within our community, it would be advantageous to encourage a member, perhaps Jamie, since she's the chair, perhaps another member of the board or the organization, to be part of our committee, just so that we have regular, timely updates as far as what's going on to help align some of the things that we're all involved in. So I don't know exactly, Melissa, what the appropriate strategy would be, but I would definitely suggest that we investigate having the Senior Resource Council identified as an important member of the commission.
Yeah.
Okay. So next would be the jurisdiction reports update. Melissa disappeared.
Jurisdiction updates for folks who are appointees. The goal is to be presenting in October. And so Wanda, thank you for asking about it today, and just stay tuned. So, all right.
And the Colorado Senior Games update.
Again, thank you to the committee members who have been a part of that with me, and we are going to be convening our meetings in the near future to prepare and be ready for next year's games. So, and I think that's going to start in September. So no real updates there.
Okay, Melissa, this is Bob. I didn't understand jurisdiction at all. What was it? It almost sounded like I needed to do something by October, but I have no idea.
Well, circling back to that, yes. So eventually we will have a meeting with the people who are the appointees from the different jurisdictions. And we have a PowerPoint presentation that will be populating with information about what the Commission on Aging has been doing. And then you'll be able to share that with the Teller County commissioners at some point in October. So we'll get you scheduled to kind of be at their meeting, and you'll present kind of a PowerPoint presentation that'll have some very specific talking points on it. Does that help?
Will be scheduled for October.
Yep. Are you out of town?
That's my vacation month, so we can talk. Okay,
Okay.
thank you.
Yep. Thank you.
So policy committee. And Colorado Center for Aging. So,
Did anybody attend any Colorado Center for Aging meetings last month? Anybody on the group? Okay, so we can skip that.
Melissa,
Yeah.
Penny again. How would we connect with the Colorado Center for Aging to get more involved in the policy discussions? What's the,
So there are two things.
Okay.
One, people can just attend their meetings that happen on Monday. And kind of during the legislative session, they were meeting pretty much every week. Now they're meeting less frequently. The one that they had, I think it was 2 weeks ago, they kind of canceled. But people can listen in to those meetings. If you want to actually kind of make a kind of stand or, kind of stand with them, people do need to be members, and they have membership levels that are very affordable. I attend those meetings and other people have attended them in the past too. They are very informative. And so it's definitely worth listening in. They do an outstanding job tracking legislation with Rich Morrow, who is the lobbyist for the kind of AAAs and out of Dr. Cog. Jared also keeps track of some of those things, but there are things that come up at that meeting that are not on Jared's radar. So it has been kind of a really good place to be tuning into information and staying on top of issues. Right now, outside of the, policy work, they've been having guest speakers come in and just kind of talking. So still doing a great job. And anybody can kind of tune in and listen Mondays at I think 9:30. And if you want to get signed up on their email, it's Colorado Center for Aging. Just go to that website and you can sign up.
perfect, thank you.
and the Colorado Commission on Aging. That's great.
The time, the timing of our commission meetings is sort of backwards. Tomorrow is the reconvening. There was a recess from official meeting in July. Tomorrow we will be reconvening and focusing on the direction for the fall. I think the important thing probably for us to be aware of right now is following the MPA, which is the Multidisciplinary Plan on Aging. And Colorado Springs, Pikes Peak region has an opportunity to sort of be out in front, because we have informally identified that the communication from our community with ideas be funneled through the Commission on Aging, and then as the communication conduit with the State Commission on Aging, I follow those. And in a meeting, Joey, the chair of the Colorado Commission on Aging, was actually at the same meeting with Jamie on Monday, and she reinforced that the energy for the multidisciplinary, or for the MPA, the plan for aging, has got to be community centered, that having a plan that's on the shelf at the state is not going to really result in the kinds of effective change that we're hoping it will. So looks like we might be boots on the ground, folks.
So the board of directors items. I don't really have a list of it. Yeah.
So I don't know, our board met last 2 weeks ago. I think the most important thing that came out of that is their approval of the housing policy document that was drafted as a result of the meeting that happened last month. We're going to talk about that a little bit more under discussion items. And think that's kind of really the highlights of the board meeting. I don't know, Joe, if anything stands out for you.
They approved forwarding a document relative to Medicaid, which basically just said the board approved looking at the Medicaid changes and taking a stand at some point. They did not take a stand initially.
And again, that's a item on this agenda for discussion items 8A. So we'll bring that up here in a few minutes, but that's it. Okay.
Under working groups.
Okay.
So social connections.
So the Social Connections Work Group, we met for the first time after our initial blending meeting and earlier. And so really the Social Connections Group, we are aiming at having different gatherings throughout the districts. So there's 12 community gatherings we're targeting between now and the end of June of next year. And we're planning on partnering with some of the current agencies that are doing community events like Hey Neighbor, Hillside Community Center, Silver Key, Senior Center, and Library. So we want to see if we can come alongside those organizations and understand what they're offering in the community and see if we can get seniors to come to some of those existing programs and events. And the goal is to increase those social connections. And we're really trying to target those areas that have a little less resources, a little less community events for older adults, and try to be a little bit more targeted in those and where we're holding those events, and have some ambassadors. So we're looking at how we want to recruit senior leaders in different neighborhoods to help recruit and get older adults to some of these events. And then tracking that and working with the other work groups too, to make sure that we're not duplicating efforts, and understanding what all the other work groups are doing.
Health and wellness.
I guess I'm sharing what happened in our meeting this morning. Our chairs are not on this particular work group. We had a lot of discussion this morning on how we make sure we are looking at our initiatives and considering the impact on caregivers and technology and resource needs. The four kind of overall buckets that our initiatives might fall under are emergency preparedness, in-home support, more on the wellness side than what would be in the home modification side, safety around crimes and potential scams, and then technology. So those are kind of the buckets we're looking at, again, with those woven through themes of caregiver impact, technology needs, and is it scalable beyond Colorado Springs, age-friendly throughout the Pikes Peak region. And I think Kim was going to try to call in. I don't know if Kim is here and has anything else she wants to add. She was also on our call this morning.
I do see a phone number on here. And so, Tom, I don't know if this 415 number, does that look like Kim's number that you've been texting her? At?
Yes.
Okay. Thank you, Tom, for making our 415 phone number live. And Kim, you are now able to unmute yourself. And if you wanted to offer any other additional comments.
And I should say, we're not health and wellness, we're safety and wellness.
Thank you.
We're wellness and safety. I'm not.
Okay.
Wellness and safety.
So Kim, we'll come back to you here. We'll keep an eye on your microphone if you're able to unmute on your side. Okay. All right.
In housing and transportation.
Well, good afternoon, commissioners. I'm delighted to be here. I'm Dave Lord. I've been involved with the age-friendly housing and now transportation for a while. Appreciate Phil is sort of co-chairing along with Chris Lewis, and then Steve is on the call. A lot actually is going on in the housing and transportation. First, I'd like to reiterate what Penny indicated. I have met with the Senior Resource Council. And really, the Senior Resource Council is the Chamber of Commerce of the business audience. And they're an important voice for us to have at the table as we're working on housing. So have worked with Jamie and really encourage, I think we've continued to collaborate, bringing the commission together, age-friendly, excited about bringing the Senior Resource Council together and getting that important viewpoint. They also have been working more and more on educational programs. So again, look forward to working. So I'm, I think the stronger we can make the voice in the community around older adults. So I think the more we can welcome and doing again, I think like many of us that are in it, the Senior Resource Council is pretty much a volunteer run organization, but really am excited about having them as part of our voices. A couple of thoughts that I wanted to bring. First area that we're working on, and I'll do it a little bit. El Paso County and the city of Colorado Springs about 6 months ago did a very extensive housing assessment for El Paso County and the city of Colorado. Part of it was a partial mandate by the state of Colorado for them to do it. It's got about 300 pages of data. If you want to look at it, some really extensive data around older adults. As the next phase of that, El Paso County did not decide, but the city of Colorado Springs said, well, we've got the study, and I think they're also getting some funding. We need to begin developing some strategies, community strategies. The city of Colorado Springs cannot do it, of how do we address some of the issues in that. So one of the things they have very much identified is older adults and people with disabilities, which would really be a combined subgroup. Tatiana Bailey, the two consultants that are working with the city on the project are the Matrix Group and Tatiana Bailey's kind of thing. And some of you may or may not be aware that Tatiana did an extensive study about a year ago doing an analysis for El Paso County of the older adults, sort of what is their situation? What is the demographics of who owns their home? How many of them are in their homes, and did that in somewhat of a comparison to what's going on nationally. She now is, as we move forward, sort of heading up the subgroup. She will be doing two things probably the next 6 months. One is she's been provided funding by a foundation to do the next phase of that, which will be to update the aging in place study and then do some convenings. I think one of the things that's interesting in that report, which I think brings up sort of the dilemma, I think often people don't think about older adults, want to try to stay in their homes. But I think sometimes people haven't really realized the income level that many of our older adults are in. And I'm sort of I'll be happy to provide, but I think around 25 or 30% of the older adults who are living in their homes are living on under $25,000. And over 50% of people who own their homes are living under $50,000. So I think sometimes people think, oh, the retired community, they're all doing great, but I think as you begin looking at people that own their homes, many of them are suffering financially kind of situation. So one of our areas that we're going to do, and a meeting's been convened by a smaller group initially, to sort of do some brainstorming around strategies, which will be the 31st. And Age Friendly has been, I guess, then the Commission on Aging Housing Group, I would say, are sort of the key people that the city and the consultants are working on. So I think our voice will be have. So some people who are sitting at this table have been in, so there'll be an initial meeting to sort of do some strategic, what are some things. Then the consultants will take that away, and then the next part gets to be, who are the partners, who are the people to move it forward, and those will become a lot larger types of thing. I realize this group's a tri-county group, so the study is predominantly at this point Colorado Springs, but I think we can learn from it. So the first area we're obviously going to be very involved in the next couple of weeks is helping the city in developing strategies around older adults and people with disabilities and trying to think of who are partners that can move that forward. A second area that there has been, which has been probably topic number one and priority number one for the age-friendly housing group, has been the conversation around aging in place and seniors needing to remain in their homes. But as many, as I just had indicated, many of them, one of the real barriers that they run into is they are older, they may be widowed, they're living on very limited income, and it gets to be, how do I get things done in the home? Some of the simple home repairs, screwing a light bulb in, putting grab bars in, which Phil does. I guess really what I would call, Silver Key's now calling it home repairs, but really safety. Sometimes they have a broken, there's just constant seniors needing assistance in their homes and not knowing where to go. There's also the same where they have a lawn, bushes that need to be trimmed. And, let's say it's a widow that's 83 years old. She does not have the ability. And there's been several meetings of a lot of people who are in that arena, anywhere from AAA with their volunteers. The mayor has tried to work with Hey Neighbor. There's good agencies like Brothers Redevelopment, Catholic Charities, Silver Key, who have been doing it. But one of the questions is there a way to, if we had one agency sort of become the hub, is there a way to better coordinate or bring all those efforts together? Secondly, there's been conversation, is there a way to get a software package that could better take and put clients with volunteers rather than doing it. So I've been actually having some conversations with a couple of, because again, nobody has money in these days, and if a nonprofit's going to take that on and try to be the hub, they would need funding to do that. So I have had conversations, favorable conversations with a nonprofit who is very much in this arena of their consideration of taking on coordinating the collaboration, and then with a couple of foundations who might fund that initiative for a couple of years. I think it'll take, as you all know, foundations sort of have processes they have to go through. And so it may be late in 26 till we find out, but I'm feeling promising. There may be something to bring together the good work that many people are doing. So age friendly has been, and then the third area when we combined with the commission is we took on transportation. As if housing wasn't enough, transportation. And I think you've got a conversation later in this meeting, but we very preliminarily have talked about it. And our commission or work group, transportation is very complicated. And the Silver Keys and the area agency and those that are in Vita and others that are in it, they're doing a lot of work around it. And it's not the thing that a bunch of volunteer. But I think where we're talking about is how we can become advocates. And I think you're all probably very familiar that some of the major funding in 27 that goes for transportation is being highly likely being reduced. I'll pick on one that I'm most familiar, Silver Key. maybe significantly. So what's going on at Silver Key is, and I volunteer there, their numbers are growing rapidly. Seniors calling in, wanting to get on the transportation, people in wheelchairs. Um, and so the demand is growing, but potentially the funding. I don't think our community has really, again, in advocacy, has thought about the ramifications of that. One of the questions that people are asked when they sign up for transportation, do you have any alternative means of transportation? I would say 90% of the people that I sign up, there is no alternatives. Uh, for people in wheelchairs, it needs professional staff. Volunteers can't be driving, those kind of things. So what I look forward, Joe and Melissa and the is how our group. I guess one of my thoughts is I think advocating, because I think if transportation's greatly reduced, it's going to go back to isolation. It's going to go back to people not being able to get. I apologize for people in Teller because I don't think they really have transportation and Park. Yeah. But ours is obviously uh, dealing with El Paso County where they already have some transportation. It may get to be reduced. So a lot going on in the transfer. The other that I'd like to add, and seems he's sitting next to me, Age Friendly has been a tremendous partnership with the AARP Age Friendly network. I think there's 25 communities. Many of them now are like us, pretty much volunteer driven as government has had reductions and they cannot do it. But we have been obviously working very closely with I just want to commend that one of the things with Age Friendly, I think, is working very closely now with Dayton here and the AARP, and obviously lobbying and trying to do. They also are an encyclopedia of best practices, from what other communities are doing around some of these issues. So they provide all kinds of resources. I think there is, which we'd have to think out because Age Friendly stands on its own, but there are at times small challenge grants that AARP makes, which are in the neighborhood of 25,000. AARP's also been giving us pretty good information on other resources of funding. So I don't know whether Phil, you want to add anything. The other, I guess I'd like to add, because Steve's been helpful in so many ways, but when we had a little bit of conversation around transportation, of course, he's with the county, and then he offered, which I haven't responded, just at a time of trying to connect us with the people in the public health area around what the transportation ramifications are going to mean, kind of situation. But Phil, did you or Steve want to add anything? You've been wonderful partners.
This is Phil Stafford. I was just waiting to see if Steve was going to jump on. No, that was a great report. I don't have too much to add to that. Other than Chris Lewis and I are planning to meet in conjunction with Dave and continue this collaboration between Age Friendly and Pikes Peak Commission on Aging. While I have the mic, I just wanted to second and even third what Penny said, that Jamie W. might be a little bit busy, but somebody from SRC should be on this committee. That would be a very, very good collaboration.
I'm
This
going
is
to
Steve.
jump in. Oh, go ahead, Steve.
Sorry about that. So, Phil, David, thank you very much. And the only thing I would like to add is, David, and I think this relationship has been absolutely amazing. And I look forward to the things coming here in the very near future, working together.
Thank you, Steve. I have a couple of comments to make. So first, I don't know if David and Bob have officially been able to meet each other in the room today. But Bob Foster, who's sitting 2 seats down, he is from Teller County, and he is on the Teller Senior Coalition Board, and he is the individual who brought forth to the Commission on Aging the concern about the Medicaid cuts with transportation. So thank you, Bob. And I know, David, I appreciate you reminding everyone that we are kind of a 3-county-wide entity, and this is definitely a work in progress. So looking forward to, constantly trying to figure out how that can look for our Park and Teller counties. Penny Everest from Park County is on the call today. She came on a little late, but she's with us too, from Park County. And so again, recognizing that we do have lessons to learn across all 3 counties, and opportunities to hopefully keep working together. And again, if Bob had not brought that to our attention as early on as he did, eventually it would have come to our attention, because Gail from Envita probably would have said something at some point too, because it is so much about Medicaid funding. But again, the fact that Bob brought it up was very timely and beneficial. So wanted to point that out and make sure that 2 of you guys have met each other. And I will be working to make sure that we are somehow able to make sure Bob and Penny get involved in the meetings in the right way, and able to give updates as appropriate, and kind of share what their regions are up to as well. The second thing I wanted to share from a housing perspective, there's not a whole lot we can talk about, but the social engagement group had really engaged with the trailer park on South Circle, and they are in the process of really facing some significant concerns there. And I will say that Kathy brought it up at our executive committee, and Steve very quickly forwarded quite a few resources for that group to tap into. And so they're going to be kind of continuing to try to figure out how they're going to survive over there as a over 55 plus trailer park community that is now owned by a different entity. So, and Kathy will update us when it's appropriate, as they kind of fill her in with pieces from there. So I wanted to make sure everyone knew that that was going on as well, and that again, our Steve, in his role, he has access to a lot of resources, and he did put a lot of information out for us. So thank you, Steve, from that. And then the last thing in the packet, you guys do have the schedule of the age-friendly Commission on Aging meetings. And for people who are here in the room, I did make sure everybody got an actual physical copy of it too. So please mark those on your calendars, plan on attending, plan on being a part of it. I've heard from some people which groups they are affiliated with, but I have not heard from everyone. So please, if you have not let me know, because Jared is having to notice those meetings, because we have commissioners attending those meetings. So we've got to notice those, and people, thank you for contributing and being a part of those. So let me know. And I think that was all I wanted to update. But I do want to give a minute, if we can, to Penny Everest up there in Park County. If Penny, you want to give any, actually, maybe we'll save this for member entity announcements. So I'll put that on pause for right now.
Melissa, can I make a real
Yeah.
quick comment? David, the seriousness of the transportation issues is not lost on any of us around here. And we've, Andy and I and Jason have had an opportunity to kind of informally talk with the folks in Denver, just brainstorm a little bit at Dr. Cog relative to what they see coming down the pike. And there were no silver bullets, there were no solutions, but lines of communication are open, and everybody's thinking about that, because we know that it's going to be some real challenges coming down the pike relative to transportation, both from the need side as well as the funding side.
Joe, I think the one thing you can do for us and appreciate is the more you can share with us on age friendly, how we can be helpful. I think, as I said earlier, the technical complex work that you and those agencies do, but if there's things we can do to advocate or be a communication tool to the community, the more you can share with us, or if we can help come up with ideas, because obviously if we lose it, we're going to have to think of some creative. So we're really here to stand by you and do what we can do to be helpful, but don't want to get into the complex job that professionals are doing.
I don't know how professional we are, but absolutely. The more partners in this, the better. We're talking to Gail this week, later this week, about some of the thoughts she has. But the more people we can bring into that conversation about transportation, absolutely, the better it's going to be.
Discussion items, we just kind of discussed a lot of transportation work session. Additional.
Yep, so I'll kind of take that on. This is the document that was prepared. So we did have some commissioners come to that meeting I guess it was the end of July, where we had Invita, Teller Senior Coalition, Silver Key, and then we had an entity that is a Medicaid provider that was brought to our attention from Mayor Yemi. He participated in the discussion as well. And so basically we had forwarded out a series of questions to our transportation providers to be thinking about and to kind of share their insights. And so you can see in this memo some of the comments that they had. And then we actually did, if you want to scroll down, Tom, a little bit further, the actual kind of recommendations there. Yep, keep going down, I think right there. So these were the core pieces that were taken away from that discussion. And those were again presented to the PPACG board, and they agreed that these were, this was content that they were okay with. And so Jared is taking this information up the chain to our elected officials and to the Medicaid Commission as well, that has I think 3 or 4 elected officials who oversee that. And even though typically an area agency on aging and the PPACG does not always take a stand on Medicaid itself, because this is such a significant impact in terms of transportation, they've agreed to kind of look at some recommendations that came from our group. And so I'm just going to read these to everybody, so bear with me. But first, there was some discussion to really recognize that rural is not really defined all that great. We need some type of rural definition that makes sense, and that the reimbursement rate might need to be different. So that was one of the pieces that was brought up. The idea that there should be a statewide broker, primarily also for insurance needs, because as the different providers, whether it's Silver Key, Invita, Teller Senior Coalition, to kind of find insurance rates that are reasonable is a real challenge. And so is it possible to have some type of statewide resource to help bring down insurance costs for transportation providers? So that was interesting. Requests for the state to identify regional opportunities to maximize, well, that's the insurance piece, I guess. Yep. And then a need to develop appropriate auditing procedures. So a lot was brought up about how the auditing process has been somewhat cumbersome, but also broken. And I know healthcare policy and finance knows that and are needing to work on it. And that's just being kind of restated again. And a need to review the driver requirements because again, Invita has talked about when they are, getting reimbursed with Medicaid rates, Teller Senior Coalition as well. Some of the driver requirements are really not necessary. So, and that will be an interesting conversation with healthcare policy and finance and this in the state. So we'll see where that kind of goes. So again, this is a document that is being utilized now And thank you to everyone who came together and contributed to those conversations. And we'll see if this can kind of help mitigate a little bit some of those Medicaid cuts. So at least go from, I think if you scroll back up, Tom, I don't know, I can't remember if we put in there the actual dollar cut, and I'm not remembering it off the top of my head, but going from like $36 in reimbursement to $12. And so the recommendation was to bring it back up to somewhere around 17 instead of 12. But even still, all the organizations talked about the impact of, you know, not being able to provide rides, how much funding they were going to be losing as a result of this, and especially in rural areas, you know, kind of the struggle that was going to just be compounded by this. So people who were there or others, any other comments, thoughts about the transportation piece?
So thank you for sharing this document. I had the opportunity to sit in on that conversation, and boy, was it powerful hearing some of the stories in the room, and ultimately the impact that is coming down the pipeline as a result of some of these cost reductions. Something that I noticed, and David, you alluded to it in terms of like the advocacy opportunity. And so I'm curious, as things kind of come together and the sort of communication, the articulation of the impacts of this in our community come together, what the opportunity can be in terms of our coordination here locally, and talking to the JVC or talking to the board, or really getting in front of these decision makers that have the ability to have those decisions on these types of cuts. So I just kind of want to flag that as a potential opportunity of what coordination could look like, elevating not only the voices of these extraordinary providers that came forward during this discussion, but also those that they serve, because I think those are the stories that go the furthest to really hear those sort of human impacts in the lives of these individuals. So as this comes together, I hope we continue to monitor it and continue the conversation of how we could, and even in our individual capacities, can convene and have these sort of listening sessions, capturings of testimonies, so that we could really harness that and point it toward these efforts.
And to that point, I wonder, are we engaging like the hospital emergency rooms involved in those discussions? Because they're going to see the people that come in because they couldn't get to their appointments and then their health declined. So I think that's an important partner as we think about those conversations.
Can I just mention, well, go ahead, Penny. I'm wondering, Carolyn, with you bringing that up, when I look at the 3 subcommittees, I'm guessing maybe it's, you know, housing and transportation. Maybe there is someone on that committee that has a relationship or wants to have a relationship with some hospitals and might think to reach out to the emergency room staff there. And I don't know, so maybe that can be something that we talk about. You know, unfortunately, I forget when the next housing meeting is happening pretty soon, the September 9th. So that's not too far out.
I think Jason commented the other day, and Becca might, I think he's been actually having, because of course he's been having some conversations with Common Spirit, kind of thing. Becca, we can maybe follow up with him, because I think he obviously is having to begin thinking if it was, is there any opportunity to contract with people. Joe, let me ask you a question. Back to Dayton's comment. In my understanding, the Colorado Department of Transportation funding that used to go to this is having to be reallocated for bridges and road structure. We could write a book on the state of Colorado's roads and how they have funded. I guess my question is, are decisions made, or is there anything that we needed to do at a right time to have voices for the legislature? I know at times when I've been trained by the chamber on how to advocate, back to what somebody just said a minute ago, the people who are in the trenches administer can go all day. But if you had a client or a few stories about what it means, sometimes it has a larger, I guess my question is, when we talk about advocacy, is this a done thing? Or do you think there's anything that can be done with advocacy to be of help to what you're dealing with?
That's a great question. One of the challenges that we face is that the Colorado state budget is limited, whether it's transportation or, in our case, we get about 50% of our funding from the Older Americans Act and 50% from the Older Coloradans Act. So we're already supported pretty well by the state of Colorado. The challenge with the state budget is you have a lot of diverse groups that are vying for that money, and we have some groups that are very well organized and very vocal, particularly advocacy groups for disability. The disability side is very has a loud voice. Let me put it that way. And so I don't know if there's a perfect way to do that. And from the transportation side, I'm going to admit ignorance on that. I don't know, but I know we've talked to Jason about some of the challenges that they're facing with some of the transportation funding that's going away. And it's a matter of, I don't think telling the story ever hurts. So gathering those stories is the first place you start.
Yeah, I couldn't agree more, Joe. And it's I'm reading this Senate Bill 2440, which concerns reviewing the adequacy of the appropriation for state funding for senior services every 3 years. And I know AAAs are going in front of the JBC next in 27 to talk about kind of the adequacy and the budget shortfalls, both in the Colorado state budget and the OAA, and how that's resulting in wait lists, et cetera. And so it's such a complex tapestry of things. And I think the opportunity really is kind of connecting the dots, which I think is happening organically here. But, I'm hearing the Center on the Center for Colorado Center for Aging. Colorado Senior wannabe, yeah. So that group, I think, do an extraordinary job on surfacing opportunities for advocacy. They're really kind of honed in on categorizing housing, transportation issues that have this ripple effect on older adults. And I don't know how that lines up with sort of the AAA's advocacy sort of efforts. And, the Rich Morrows and the C4As of the world, of how they're kind of pointing toward the legislature.
Rich working out of Dr. Cog is a critical component in that whole process. And I think there's a good coordination right now. It's just the total number of dollars that are a challenge.
Sure. Yeah.
And Melissa, I just wanted to circle back to your question about the health systems. I know our work group, the Wellness and Safety, was going to reach out to them as well, because they're both age-friendly health systems. And so there should be alignment between their age-friendly health and our age-friendly community wellness and safety goals, and so how we can support each other. So.
The other that might be, and I certainly haven't read it, but I believe there's a ballot initiative in November around, if I'm understanding, I think the ballot issue that's going to be on the ballot is that the money that's been collected for taxes and things for things like transportation, which may be roads, because I think one of the problems has been we've had fees in the state which are supposed to go towards roads, but the legislature has gone and used it for other things. I don't know, but it may be worth, probably taking a little bit of a look at this ballot issue. And again, I don't know where, but obviously we all know that our roads are an issue. But again, just seeing if there's anything in that ballot issue that if it went through could be of help to it, or whether the initiative is primarily taking all the money for highways. And Dayton, as you and AARP monitor, if you have any stuff that can help us to understand all this legislation and what we might be able to do on that level. I don't think, Joe, there's much of anything we can do on the federal level, is there?
And you know, that's one of the big challenges. While this discussion was going on, I was thinking in the back of my mind, we're all talking about ways to address the symptoms rather than the problem, which comes from the top.
Well, with that, Joe, working from the bottom up, I think one of the things that we have an opportunity to do, much like Carolyn and the Wellness Safety Group look at, what are those through lines in the age-friendly work groups and caregiving, regardless if it's going to impact probably all three work groups. Transportation may be one of those through lines that we need to consider too, because I know that on the social engagement, if you can't get there, it's really kind of hard to integrate and be a part of a community. And there may be some creative opportunities for identifying potential partners. Yesterday in a conversation, utilizing church groups that may have transportations within specific neighborhoods or something like that. I'd never even thought of that. So I think we do have a huge opportunity to be a ground zero advocacy opportunity for connecting the lines that we're directly involved in.
So the 4-year plan, community meetings.
Thanks. So we are moving forward with our 4-year plan community conversations. Our next one is happening next week in Monument, and Erin is attending that one. I don't know if anyone else from the Commission on Aging has told me that they're planning on attending the Monument one. Penny, thank you. And of course, anyone's welcome. Please feel free to attend. They've been going quite well. And interestingly enough, we've been able to already be tracking some of the findings from these community conversations already, because as you can see on the flyer that we have, people can actually go in and answer questions on our website that are fed up to the State Unit on Aging directly. We also have data that we have been taking, and that gets sent up to the State Unit on Aging as well. And the two things that are already rising to the top as the #1 needs are transportation and caregiving. So not housing yet. We are very early in this process. And when I say transportation and caregiving, that's not just for our region with our information that's going up, but that's the whole entire state of Colorado, the data that's coming up into their Google Drive spreadsheet that they're tracking information on. So it's kind of exciting to like see it a little bit as it's progressing over time here. So I just wanted to share that with folks today that, you know, there's really good information that's coming in right now. Dayton?
I am excited to participate or at least listen in to the Monument community listening session. And I had the opportunity to listen in on a Dr. Cog listening session, and I also work with the community action team in Denver, who is kind of doing their same thing up there in Aurora and other municipalities. So happy to share notes, et cetera, of some common issues that are surfacing. Melissa, I would love if you could kind of point to the group, the recent pivot, which I felt kind of flew under the radar, at least for me it did, with the COSOA not being implemented this year. My understanding is it's the first time in over 2 decades that it hasn't been a part of the 4-year planning process. And so we're relying on an alternative data source and our listening sessions, which is a part of our process anyway. So just kind of interested in what that alternative data source is. Is it reliable? Is it as strong as the COSOA? And is this for the foreseeable future?
So I don't know if Joe will have any comments because he kind of wasn't involved in the preliminary hard work that our other AAA directors and the State Unit on Aging tried to secure funding for the CASOA, and they weren't able to get funding for it. So for people who are not familiar, the CASOA, the Community Assessment Survey for Older Adults, is a very, very robust data collection process that was started, I think, out of the Boulder area and also expanded nationwide. And was a really good tool because it tracked a lot of data points for people who were aging. And we also then had, consecutive historical, figures to be looking at over time, and not to be able to do that now going forward for possibly forever or possibly just this cycle unknown, is very disappointing, to say the least. However, I will say that one of the really interesting pieces that came together this year with the State Unit on Aging, they have a data analyst that her name is Dr. Erica Felder, and she took we actually kind of thought ahead and put questions into the AAA annual surveys. So, as an area agency on aging, we're required to send surveys out. Mariah kind of ends up being a part of that. She will be next time. She came on too late to be a part of it this year, but we send out surveys to all of the clientele that get services from the Area Agency on Aging, so thousands of people. And we did put questions in there that related to the 4-year plan. And so people who responded to that survey did answer those questions. So we have that data, which is nice across the state. It's small. It's a small number. And in that case, it's only people who received AAA services. With the CASOA actually went out to anybody over the age of 60, right? Well, a statistically valid, randomly selected group of people that the CASOA sent their information out to. So people who were not getting AAA services would have gotten this survey and said, oh my gosh, why am I getting this? But lots of people got it and they answered it. So it is a gap this year with us not having the CASOA. I don't know what the future plans will be. Joe just jumped in and has been attending the meetings now at the state level, so I don't know if he's heard anything. It's probably not, but if you have, you can share. But so for now, I have been, as the person who's putting the 4-year plan together, I have been very excited about seeing the information that came through from the surveys, and then also seeing the responses, because anybody is seeing our flyer, and so they can go in and answer the 2 questions on our website that gets fed up to the State Unit on Aging. And so seeing that data coming together is kind of exciting, but also, I'm going to miss the CASOA for people who, when you signed up as a commissioner and got a 4-year plan, that big book that's bound, the majority of that is the CASOA and the results from the CASOA. So if you need to be reminded, you can go look at that at any time and go, oh, so this is what, we're not going to get this year. But I don't know what'll happen in the future. So.
Melissa, just another question too, the data that you're collecting on the website and the information you're gleaning from these listening sessions, how will we have access to that in the work groups to be able to say, oh, are we targeting the right?
Yes, yeah. So I'll definitely make sure that comes to the work groups for sure. And probably you'll start to see that in a work group as early as October. Because we will have our final meeting September 22nd. And so then we'll have data ready to go right after that. Along with those lines, I will say that the 4-year plan, from my perspective and what I'm looking at, is very much aligned with the state multi-sector plan on aging. There's total alignment there in charts. And I would remind the work groups that maybe we actually have a copy of, the directives from the multi-sector plan on aging, as part of the materials that go out on a regular basis with the work groups, so that's always in front of the work groups as well, to kind of see where, the idea of, having community gatherings, where does that align with the multi-sector plan on aging, our housing and transit stuff, you know, where does it directly align? Because there's a lot of, as people know who've looked at that there's a lot of stuff in there. And so it'd be interesting to just kind of line it up a little more.
And I
So-
did kind of create some of those frameworks. So as we look at initiatives, we might, each work group might not pick something that aligns up across all 4 areas, but as many as we can pick, I think also helps us decide who can be at the table to support that. And I just want to share, Kim texted that she'll attend the September 14th session in Pekin.
Oh, okay. Love it.
I would make a quick comment about the CASOA. It was a very broad-based survey. You know, when you're talking about 20,000, I think when I left, and that was 6 years ago, 20,000 people, that's a very broad-based group. However, the thing that I like about what Dr. Felder's doing is that is obviously our target population, because those are people that have already used our services. So if you take the best of both worlds, you probably have the perfect survey. But the CASOA would be nice to have back, just because of the sheer breadth of it, the numbers.
Yeah, I thought it kind of gave us a commonality within the aging space across the state, given how many regions and communities were using that same sort of unifying data set. Is the same with this new, the alternative at the State Unit on Aging, they were kind of unifying that data. Because I could see if it's a slippery slope once you start collecting different data sets, and you're kind of advocating for the same things and speaking different languages at state level.
I think it's going to be hard.
I have a question or a thought. In our effort to work on collaboration and bringing our efforts together, and I think you partly talked about it, but it sounds like when you get done with it, you will have done a bunch of listening to what seniors feel is on their minds. Is there a way, I think one of the thoughts I guess I had, and maybe at some point it's us doing another larger convening of the work groups, where maybe you all share what you're hearing, and we maybe try to think again where the work groups, you know, what are tasks on there that you feel that the work groups could be helpful, or the work groups itself. So I guess really what I do, I really appreciate as we try to do our work supporting together, Melissa and Joe, as you get done with your listening session, if there's ways that we can integrate it, maybe the easiest way is we do like what we did in the senior center in June, do another convening, and you and Joe or the proper people come in and do a little bit of an overview, and then maybe we do. But I'm all for doing whatever we can to support the work you're hearing from the seniors.
Thank you.
Thank you, everybody. Nice. So are there any member announcements?
I have one that I did not share during membership, so I'm just going to circle back. So Kent Matthews did resign from our Commission on Aging. So we won't see Kent here. We will probably see him in work groups, but he's not coming. He had to step off the Commission on Aging. And so with that, happy that we have potential Silver Key member, potential SRC members. Steve will be in touch to reach out to folks, and then any other members that kind of come our way too. So just, I forgot to mention that during membership that happened. So that's one update, and then I'll turn it back over again, Kathy, other member entities that want to give updates.
Anyone else?
So sorry, I feel like I'm talking a lot this afternoon. So AARP Colorado has prioritized caregiving this year and for the last 2 years. And so we have what we call a caregiver blitz upcoming in November. We've actually had a first meeting with Amy Harris from the State Unit on Aging, Lucy from here joined us as well, and some others from the state to begin thinking about what a caregiving event could look like in November. So that's an open invitation to anyone here who would like to join that meeting. We thought it could really start with hearing from caregivers themselves. So rather than design for them, we would like to design with. And so right now we're kind of in the midst of co-designing a survey to hear from caregivers to see what that event could look like. We're tentatively looking at mid-November for that to take place at the senior center. So again, open invitation. It's very preliminary stages. We've had one meeting, so nothing crazy. And I know you all have caregiving high on your radar. So big invitation to you all who have that as a focus area there. And overall, just excited again to collaborate with you all here today in the AARP capacity. I'll certainly hear you, David, on whatever I could bring forward from the AARP standpoint, from an advocacy sort of educational lens or other pieces. Happy to do so. And yeah, thank you all.
So now we're gonna go into the meetings. Oh,
Yeah.
I'm sorry.
I'm a little slow, so. Delaware County Senior Coalition is 30 years old as of last Friday. And we had an open house and had over 100 people that came by and said hi and ate all our food. And so, but we just appreciated that. I have been volunteering driving for our organization for about 2 months now. And I brought at the last board meeting, I said one of the constant things that I get, I don't especially like to drive, it's hot, but I like to, but I love to talk to the people that I drive. And I don't drive any Medicaid because I'm a volunteer and I can't pass the test or something, but anyway, but one of the things that came up over and over again is that they were having a hard time getting in touch with us or were frustration over being on hold and all this stuff. So anyway, long story short, we are looking to get an AI answering service that would be 24 hours, that would be able to sort it, whether it's case management, whether it's repairs, whether it's mostly transportation, or 800-pound gorillas transportation. And then food is the second, is a 400-pound gorilla. So Kathy asked me to say, is there anyone, because we're not a 1 or 2 person, we got 35 people on staff and we're looking for another dispatcher. So somebody lives in Teller County wants to come in and dispatch. I hear you have some. So if you'd like to, we'd even pay you to come up. And but anyway, if anybody has any expertise or has used an AI system, we're looking at one now, but it's brand new, and meaning that the company is brand new that's doing it. So anyway, I would, if somebody would say, yes, we do, I'll call you, talk later. But if not, then maybe we're ahead of the field. But that's something we're trying to do so that because people cost a lot of money, and if we can somehow capture it and get it to the right person on our staff, et cetera, without a lot of hassle. So anybody doing anything? No, okay, we'll be the pioneer. So
Bob, would love to connect with you afterward offline. Two resources that come to mind. I know Jonathan Lieber with the BBB is doing some great work in the AI space, and he might have some directions, some resources in mind. And my former employer, Older Adults Technology Services, focuses on technology for older adults, and they have a partnership with OpenAI, the makers of ChatGPT. So they're really leaning in fully into AI right now. They might have some guidance and expertise to offer.
good, I'll give you my phone number. And then the last thing, just to finish up, is that we did a collaboration with UC Health, and we now have on 9 of our 14 vehicles. They partnered with us and gave us enough money that we have defibrillators in all of our 9, and we all went through training. And so now all 911 operations, which is a sore subject with us in Teller County for you in El Paso County, but we won't go there, but they know where all of our vehicles that have, so that if somebody needs one and we happen to have a van nearby, they can we can call and see if it's appropriate for them to stop by and get a defibrillator. And so that's it from Dollar County.
Any? The other-
Penny online first.
Oh, Pam.
Good afternoon, everybody. Just wanted to let you all know that I had a meeting with Denver Mobility, and they're looking at doing work up in Park County to help get medical people rides. And it's looking really good. They do have a good chunk of money to be able to help out there. So I just wanted to let you know about it.
Who was that entity again?
It is Denver Mobility, Latoya. Melissa, I told them about you and asked her to get reached over to you and also to the Alliance folks up in Bailey, because they're working on a transportation deal.
Thank you.
So I just wanted to let everyone know there's a new Colorado Falls Prevention Coalition that's just started, and they're having their Fall Prevention Summit up in Denver on September 22nd, 8:30 to 4 p.m. So any of you that are in the fall prevention space, that could be a great event to go to. And the coalition is brand new. They just started this year.
Anyone else? Yeah, I don't see anything. So next up is the meeting schedule. Our next meeting is September 16th at 3. He's always the first Wednesday at 9. And the policy committee meetings are to be determined. And the working groups.
Again, we handed out that handout. So
Oh, yeah, that's true. Yeah. Yeah. Meeting schedule. And that's it. So, okay. Okay, so we are adjourned from this and we have a JAWS award ceremony.
Oh. What's that? It's yours.
okay, so meeting is adjourned. For people here, people on the call, thank you for calling in, and we're thinking about you guys all. Talk to you later. And for people in the room, please stay. I just want to make a few comments about the JAWS program. And we do have a special guest who joined us here, Connie Garrels. She is one of our volunteer ombudsman who actually did some work with the JAWS program too. So a while back, it was brought to our attention that we might want to submit the JAWS program to US Aging for an Achievement Award. So we submitted it. I have submitted other programs since I started 7 years ago, and nobody's ever won. And so congratulations, JAWS and Penny, for finally getting Colorado Springs on the radar there, at least from the Area Agency on Aging side. I've seen the Independence Center. They got an award, I think, 1 year a while back. But anyway, super, super glad that the US Aging team, kind of reviewed the JAWS program under this workforce development and volunteerism category and selected them as one of the winners. So I think most people in this room know all about JAWS and what JAWS has done. We've had the benefit of having the students in the room presenting many times because Penny did realize how important it is to get those young people in front of professionals, and the professionals have been so impressed. They've also presented to the board of directors of the PPACG, which absolutely led to some really interesting conversations with people that were very excited to see those students. I know the mayor of Fountain, Sharon Thompson, when she heard them, and she was the chair of PPACG, was so impressed and really, shook the hands of those kids and really welcomed them and thanked them for what they did. So, we have some food. I really hope people will stick around. We usually don't get done till 5. So hopefully stick around for a little bit, get to know each other a little better because we don't always have the opportunity to visit. And again, we have Becca in the room from Silver Key, Mariah, who's new with us, Joe, who some people know, and then Connie. And so maybe Penny, if you want to just share a few words and yeah.
I mean, talking is, I'm sort of like Dayton. Oh my goodness, a lot of talking today. Looking back and PP, the commission, well, it starts clear back at the Council of Governments. JAWS started actually in 2022 as a thought proposed by UCCS, really with the focus that we've got a problem in our community focusing on the closure of 4 nursing homes. And many of you maybe think back to those early days of COVID, and 7 nursing homes statewide closed almost immediately. Most all had a relationship to workforce. And the real shocker was 4 of those communities were right here in Colorado Springs. And so my background had been in working with long-term care organizations for a while, collaborating with UCCS. So I talked to Sarah Qualls and I just go, oh my gosh, what can we do? The information got to UCCS that El Paso County had received ARPA funds for that were to be targeted to challenged workforce. And that was really the beginning of JAWS. And Judy Scott was the one that came up with the JAWS acronym, Jumpstart Aging Workforce Solutions. And it actually has stuck and people are talking about JAWS. But the importance of student engagement, I never, ever thought that when we had 8 students from Fountain Fort Carson High School, and Connie was one of the very first persons that they met with the ombudsman team, that those 8 students would have be part of a project that is now in 8 different school districts. And Carolyn was at the National Conference of U.S. Aging last week with us, and the CTE instructor from Fountain Fort Carson was amazing. She made all of these spaces and PowerPoints look real. And I was even absolutely floored by the announcement that she had given. Fountain Fort Carson had just started the day before our presentation. And she said, since JAWS, the implementation of JAWS as part of their CTE programming, that their healthcare classes have quadrupled. They said that they are busting at the seams. Students came in on Tuesday saying, okay, where do we sign up for JAWS? Kids love this. A conversation that I had, Fountain Fort Carson is developing their own continuum, but we've developed a very strong partnership with PACE that will more than, when the project closed as an ARPA project, we had 250 15-hour experiences. These aren't kids walking through and looking. They're actually spending time getting to be part of care communities. And now Silver Key helped us partner and pilot a cogen project where we had young people, older people looking at community services. Over 250 student experiences. This was now almost old data, 4,000 hours. When we look at the hours of students spending time in long-term care communities with older people, we're going to be above 6,000 hours. That is pretty remarkable. I mean, that's spending a lot of time hanging out with old people. So one of the projects that Carolyn really, she goes, and well, Connie was the first, the narrative project. We had 2 pilots of that. Connie was the very first person that collaborated with a Fountain Fort Carson high school student the potential for our narrative project. And I think I will hand off to Carolyn with what we learned at the conference last week is mind-boggling. So you keep your shoes on, Connie, because you are not going anywhere from us. But Carolyn, just share the enthusiasm.
Well, and before I do that, I just want to say, I think this is so impactful for the students, but also for the older adults. I mean, we talk a lot in some of the other work I do about how we as older adults don't lose our need to be needed when we move into long-term care communities, and for these older adults to know they're helping students.
Yep.
Maybe determine their career paths, I think is just, it just always gives me chills when I talk about it. But Penny and I have been talking about how do we tell the story in the visual way that helps secure, additional funding, or really does that advocacy piece and tells the story. So we are on a mission to bring in that digital storytelling piece to tell the story of the narrative story and all the big work.
Exactly. And the thought was there at the very beginning. Get kids that are involved in documentary filming. So it took us a little while, but I think we're getting there. And we have the interest of a national person that's what they do. He came up to our presentation. He said, you've got to capture this on video. You just have to. So Carolyn and I will be talking to him next Friday. But I think really relevant. I mean, all of this is relevant to what we talk about here, but particularly advocacy. I think that one of the areas that we need to look at a through line for with Age Friendly, with the commission, with all of the other entities is how do we utilize student voices, whether they're high school students, university students, to help tell the story. Because the young woman that was part of that first group that Connie and the other ombudsman met with, someone said, why do you do this? And Sienna said, she was probably a sophomore at Fountain Fort Carson that year. She said, we do it. They just finished a presentation to the Pikes Peak Council of Governments. She said, we do it because when we talk about JAWS, people listen to us. As a teenager, people don't listen to us. I think the opportunity to engage students to become part of that upfront voice, talking about the issues that we're all concerned about will be an important opportunity for people to stop and listen. So thank you all for your support. Students already look at when do we talk to the commission? When can we share? We're going to have some good stories to share this year. So stay tuned. Thank you.